Greetings, colleagues. I'm Dr. Lynn Johnson from the University of Michigan School of Dentistry. I'm here today to make this recording to explain a few aspects of the collaboration for health IT. Why did three schools come together with Internet 2 and ICE Health Systems to form the collaboration for health IT? To the schools, the electronic health record is a foundational tool in order to improve personal and population health. Also, what we needed was a service provider who was willing to listen and use researchers and healthcare providers to drive the software development, and also a service provider who was committed to continuously improve and refine the product. We needed this type of a relationship because providers and researchers understand how to conduct research locally, nationally, and around the world better than any single service provider does. The collaboration gets our work done by recognizing the needs for an EHR, such as possibly a new data migration tool, and we then bring experts together from across all of the schools in the collaboration and sometimes even outside the collaboration. We then write a charge for these working groups and the deliverables we expect from them, and then we also give them a time frame for submitting recommendations that are presented to the advisory board. The advisory board then approves or not these recommendations, and then ICE will put these recommendations into place. We had 8 founding principles. The first 4: efficient clinical experiences, support of learning, excellence in collaboration and communication, and dynamic data access, I will not describe. Instead, I'm going to spend the short time I have with you to hear today to talk about the last 4. Let me go through those one at a time in detail. Exceed security regulations. From the very beginning, we recognized that security was paramount. Our aim that ICE would earn international certification for its security work. And currently, it is the first electronic health record to have achieved a third-party audit, and it is now striving for ISO certification. So what you see here is just an example of some of the security controls that are put in place as a part of a security review that was done by the University of Michigan. Standards to support research. From the very beginning, we wanted established standards to be used across all the schools. So we had working groups that went out, did the research, and selected standards that were then approved and now implemented within ICE. Here you see 4 of the standards that we have adopted. ICDAS, this was selected by the CARES working group, and CARES standards are now in ICE. ICH has good clinical practice standards, and that is also in ICE. ISO standards, ISO 27001 is a security standard for third-party audits that's underway. And then SNO-DDS, these are standards for diagnostic codes that have already been implemented in ICE. And I will say SNO-DDS are also diagnostic codes that have been embraced by the American Dental Association, and that members of the collaboration are also part of the standards committee for the American Dental Association. Foremost, software engineering practices. From the very beginning, we wanted to only have the best programming practices used in the ICE health record. This screen shows you how data from multiple sources is brought together. The screen on the left shows how data is brought together that allows the clinician to view the most recent data that was entered, possibly even by others, about that patient that they are seeing at this point in time. The screen on the right is a dynamic data display of real-time information that displays trends for a researcher. Robust interoperability. We recognize that not all data is going to come from the electronic health record, and that all data is not going to be entered using a keyboard. We have already done integrations with Google Glass, the new generation that's about to be released, Lexicomp, a drug database, a medical support system, and also with the health tracker Fitbit. Underway are integrations with Epic, one of the larger medical record providers, DoseSpot, an electronic prescription system, and connections are being made into MyPax, a digital imaging system. Thank you for your time today, and if you have any questions, please feel free to contact me. Here's my email address. Thank you so much.